Hi, this is Joan Johnson again from J. Johnson Education Center, and we're getting ready to do another skill for you today. The skill that we're going to be doing today is a bed bath, but it's a modified bed bath. It's like a partial bed bath to some degree. The bed has been locked. I've sanitized, put my gloves on. I've provided privacy. I knocked, I came in. I asked her name. I told her who I was. And then I told her I'm going to give her a bed bath. So now that I've done all those things, I am going to put this in some position. What I'm going to do is put the bed up again, because it's just better for me if it's up. Body mechanics is very important when you're doing cares for residents so that you don't strain your back, okay? So now I am going to fold the covers back. I asked her to test the water. The water is fine, because I want you to always remember anytime you're using water that you always have them to test the water, because remember, you can test the water, but your touch is different than theirs. So allow them to test the water. Then I'm going to take the bath blanket and I'm going to put the bath blanket over her. I pull this down to her waist or so forth. Okay, so I have the bath blanket on her. I'm gonna raise this up just a little bit more for me so I don't have to bend so much. So now she has on her gown. I am going to take off her gown and I'm going to ask Susie to help me to lift up. And I'm going to ask her to take her arms out of the gown here for me. Trying to keep her covered as much as I can. Okay. Now remember that these skills are all separate skills. And you need to practice them from beginning to end so that you learn all of the steps. But remember, pretty much everything is the same in the beginning. Hi, my name is. What is your name? You're providing privacy. You're locking the bed. Okay, you're raising the bed. And then you're doing the skill. If it's water, you're checking the water, having them check it before you begin to do whatever it is that you're doing. So now I'm taking her gown off, trying to keep her covered. The gown goes in the soil linen. And now I'm getting ready to do her bath here. I am going to take another towel and I am going to place it across her chest. Why am I doing that? One, because while I'm doing her face, if I should drip water, I don't want her to be cold or wet. And then I'm going to be using that same towel to put under her arm. So when I wash her face, I'm going to be washing her face without soap. There is no soap applied to her face. Okay? So I have my towel here and it is folded. I am going to do under the eye. Flip under the other eye. Then I'm going to rinse. Why am I rinsing? Because if she has crust in her eyes, I don't want to put that on her face, right? Then I'm going to do the face. I start up here at the eyebrows and I do all the way down across the nose, flip, again, up across the nose and the lips, flip, and we did that. Now I'm going to rinse. Why? Because what if she has something on her mouth? So I don't want that in her ears. So I've done under the eye, flip, under the other eye, flip, rinsed, face, flip, and then rinse. Now I'm getting ready to do the ears. So I'm turning her head behind the ear, flip in the ear. I'm going to flip again, do the other side behind the ear, flip in the ear. Now I've done the face. Now I need to do what? Dry the face, okay? So here I am, I'm drying, patting gently to make sure she's all dry. Flipping as I'm doing things, flip in the ear, flip behind the ear, flip in the ear. So now I've done her face. Now it's time to do what we call the modified bath. You don't have time to do a full bath for the state. And of course, if you went into the nursing home, you would not be doing just one side of a patient. You would do the entire patient. A partial bath would consist of the face, the armpits, and the peri area. But what we're doing is a modified, because you're going to the state to take the test in your time and you don't have all that time. So I'm going to take this towel, and it doesn't matter to me which arm you use, and I don't believe it matters at the state, but I always teach the students that I always like to do the arm that's furthest from me. And the reason I do that is because if I'm taking care of patients in the nursing home and I'm going into different rooms, I don't like to cross-contaminate. So if I was to do this arm first and this arm is clean, and then I have to reach over to clean the other side, then that would become contaminated because my uniform may have touched something or touched another patient. So I always like to just teach you that when you're doing things, to just do the other side. For the state, it does not matter. Again, I just told you it does not matter, okay? So I'm taking that same towel that I used to wash the face, and I'm putting soap on it, because now I'm going to do the arm, the hand, and the armpit, okay? So I want you to see what I'm doing here. You see the back of the arm? The back of the arm, come down, the fingers, flip, come down. I'm still doing the fingers on that side in the hand, coming down, and then I'm flipping because I need to do the armpit, okay? So let me show you what I did. See the back side of my arm? I'm bringing it down here, my fingers, flip, here, my fingers all the way down. Then I'm going to flip again and do the armpit. And if you notice, when I do the armpit, I'm going down. I'm not going across, but down, okay? So now I am going to rinse. Okay, I'm doing the same thing again. Coming down, did the top of the fingers, flip, did the inside of the hand and the fingers, come down, and flip my towel again and go down, okay? This skill doesn't take really long to do. It's taking a little bit now because I'm trying to explain it to you. Again, so now what am I doing? Patting dry. Patting dry, okay? And I'm flipping my towel around, trying to make sure those fingers are dry. Patting dry, going down, and then I'm flipping and doing the armpit, okay? I'm all done with that. Now I'm gonna take this, put it here. Now it's time to put on the gown. So this is one of these skills that you will actually be doing on a person. So you can always ask that person to help you to put their arm inside of the gown, of course, if that's what they're putting on, or if they're putting on a button-up shirt, whatever it is they're putting on, you ask them to assist you because they can assist you with that. You're just doing the bath, and I'm asking Susie to sit up for me while I tie this gown. Do not leave it untied. Always tie and make sure their clothes are fastened when you're doing things. So now here's Miss Susie. Her gown is on. I can remove the bath blanket, trying to keep her covered as much as possible. I dispose of that. I put the cover back on her, give her her call light, put my bed in its lowest position. Susie, thank you for being cooperative. And if there's anything else that I can do to assist you, please let me know. After I put that bed down, then I'm going to dispose of everything that I have here. This goes into the bathroom, into the toilet. You rinse it, pour it in the toilet, and then you dry it out and you put it back where you got it from. This is the skill for bathing. You have a wonderful day. Thank you.